The day I was diagnosed with cancer was the 4th of July, 2019. I rocked up at my doctor's. My doctor was actually away, so I got someone who I had never met before. I sat down and she said to me, how can I help you? And I said, I'm just here to get some results. And she jumped on her laptop, looked up, and as soon as she did that, I knew it was not good news. So I said, is it cancer? And she said, yes. I guess the hardest part of diagnosis is actually telling the people you care about. It was actually really hard telling our kids. But my parents, that was the worst, because you never want to tell your parents that you're not going to be around. So after diagnosis and reality sets in, I was extremely relieved to know that my income protection would actually apply and that I could apply for that through NGS, through my super fund. It was already there, it was existing, it was part of my package. They were able to pay me a portion of my income, which actually supported our family while I was going through treatment. I had 4 surgeries, 12 rounds of paclitaxel, which is chemo. I had 27 rounds of Herceptin, which was every 3 weeks through my port and my chest. I also had 25 rounds of radiation, and I ended up with 3rd-degree burns, all through my arm. And I can't see, as a teacher, being able to stand up in a classroom. It would have been productive for me or my students. My only advice for anyone that's working, anyone that requires an income to survive, is that income protection gives you that peace of mind that, heaven forbid something happened to you, you're actually covered, and it not only protects you, but it protects your family. 5 years on from diagnosis, 5.5 years on now from diagnosis, I still have side effects as I'm still on medication for my treatment for my cancer. Gratitude every day is really important for recovery. I'm grateful that I'm here. I'm grateful that I'm here for my kids. I'm grateful that I'm here for my husband. And, you know, I'm just lucky. I'm lucky, so much luckier than many. I've not always had the same super fund, and it was only a couple of years prior to my diagnosis that I swapped to NGS, and I didn't know much about them, but the more I looked, the more I liked. It's easy to navigate. They're online tools. It's always easy to call someone and talk to someone if you don't understand something, and the support that you get is next level. So I was really happy.